In this section on multi-source feedback, we're going to talk about what you'd actually say when you're debriefing trainee doctors and you end up with a glitch or two or a challenge. And I'd like to preface it by saying that trainees are a bit vulnerable. They may be very vulnerable. And there's always a power differential, particularly if you are their supervisor or are otherwise evaluating them. There may be levels of discomfort that are in place regardless of what you say or do. And so it's important, of course, to set the expectations, but it's also important to recognize that there can be challenges based on gender, ethnicity, the trainee doctor's school of graduation or country of graduation, age. Many things may contribute to the vulnerability. We're not saying that you shouldn't do coaching. We absolutely think you should do coaching, but to be attentive to some of those vulnerabilities, particularly if things seem to stall or the trainee isn't particularly forthcoming. So when you're working with a trainee doctor, and we're just providing some points that will engage the trainee if the conversation stalls, and they help you move into the reaction and content stages. And of course, you do remember that the model is based on the relationship, exploring reactions and reflections, confirming content, and then coaching for change so that you can co-create an action plan. When you're working with the trainee and trying to establish that relationship, and you may already have a relationship, but what you want to do is make sure that you set the agenda for the session and that, to make sure that everybody's comfortable, ask about current and past experiences, or ask how the current rotation is going, how the work experience is going right now. I think it's important because you will have reviewed the report prior to sitting down with the trainee. Make sure you've noted the strengths on the report, because while you want the person to improve, it's also critically important to reinforce what the trainee is doing well. And then once you and the trainee have determined your 3 areas for development, you want to proceed with coaching so that you can get a commitment and help the trainee be as specific as possible. What will they actually do? How will they do it? What's going to enable their success? What might present barriers for their success? And then have a timing in place and a follow-up plan. Now, it may not be you doing the follow-up. It may be asking the trainee to identify the supervisor on the next rotation who can give them feedback on their progress. But there should be follow-up or a mechanism for follow-up. So the first, what would you do if, or what would you say if, is you have a lot of data and it needs to be prioritized. And sometimes that is just the way these reports go. There's a lot of narratives. Sometimes they conflict. Sometimes there's so many ideas that you could have for action plans, and you can't do it all. Really give some thought to, are there issues of patient safety that you're concerned about with the trainee? If there are, that would be an area that you'd really want to make sure that somewhere in the action plans you begin to address that. but you might also have concerns about professionalism, communication skills. Make sure that you identify what you think are the most important, and so that the discussion can focus on them. Because there's no way a trainee can leave a session like this with a long list of 12 things that they can improve. 3 is about all we can handle. And, ask open-ended questions. When I read the report, I thought about, or I noticed that, what are your thoughts about this? So there's certainly ways to get at it in a gentle but effective, and sometimes you have to be more directive than not.
I think, thanks, Jocelyn. There may be occasions when the trainee is not prepared for the discussion. Now, you would expect that in a training environment, the message around multi-source feedback would have been communicated in a way that says, when you receive your report, please spend some time looking at your report, using the reflective guide in the report to further understand your results, and that the trainee would have prepared for the discussion with the trained coach or the supporting medical colleague or the GP supervisor or the medical educator. So you'd expect that would be that this may not happen, but occasionally it does. And if it does, and the trainee, for example, hasn't had time to review the report, it might be worth rescheduling that appointment to ensure that there's value in the debrief with the trainee. I mean, you may want to ask, what got in the way of not being able to debrief your report. I wouldn't focus on that too much, but it's more about we'd like to get value. I want to support you in understanding these results. We need to give it the dedicated time, and you need to give it the time to reflect on these results, because they're quite valuable results in the sense that they provide a lot of insights. It's not just, for example, one person providing insight. It's 42 or more people providing insight, 30 patients at least, and at least 12 colleagues. So rich information that the trainee can draw on. And if they haven't had that time to reflect on that report, I think you might be better rescheduling the appointment for the debrief.
It's rare, but occasionally you get a trainee who wants to focus on the positive without coming up with solutions for areas that need improvement. I think this comes up most often when you have a trainee who's afraid of losing face, or a very vulnerable trainee who isn't able to reflect, perhaps trained in a different setting where the doctor always knows the answer, and it's hard for them to deal with recommendations and suggestions for improvement. There are sometimes, if you are a physician yourself and doing the coaching, you might remind the trainee that we're dealing with a growth mindset. We all have areas. If you're comfortable, you can share some of the areas you personally are working on, so to normalize the effort of improving and continuously. You might also state something like, I see from the report you're doing reasonably well, but we can all grow as doctors and must keep critically reflecting on how we're doing. But, you know, when I looked at your report, there are a few things I noticed. Well, what are your thoughts about these particular things? And then push and be a bit more directive about how, first of all, they have to acknowledge this may be an area of interest. We know from the research that co-development seems to lead to more likely implementation, but push to get an agreement that that's an area that they'll work on, and then work out a plan for how they'll do it and when they think they will be successful and will know they're successful. Now, occasionally we get a trainee who is angry and upset, and sometimes you just have to work through that and figure out why they're angry and upset. And it may be related to some of the power differential. It may be related to something that went on that day. And if you can figure out what's going on, then, and you feel you can do a successful session, proceed. If you don't, you know, if they've had a patient who's died that day, that they unexpectedly, some family tragedy, you know, you might just want to back off and reschedule the session when it can be a productive session.
Yes, occasionally. Thanks, Jocelyn. Doctors may get some negative feedback from non-doctor sources. Now, some reports, the report, depending on the type of multi-source feedback that the doctor receives, or the trainee receives, some reports have a breakdown of doctor versus non-doctor scores, but the comments, I've found that some of the trainees, they may know who's provided that particular comment, and it may be a non-doctor. And it may be, I haven't come across this too often, where they may want to dismiss that particular comment because it's a non-doctor. And I would often explore with them, you know, what makes them say that. You know, in the framework of we can learn from all sorts of people in a care team, that we are team members and everybody within the team is important. So, but I would like, it's more important, that's me giving advice, but I'd want to hear from that trainee what makes them think that the non-doctor source, say it's a nurse or a practice manager, it provides feedback to help that trainee do better. What makes them think that's less valuable? And that can be an interesting discussion in itself and open up some conversation that in a positive way may lead to some things that the trainee sees that they could improve. Because a lot of the multi-source feedback, whilst there's some questions on clinical ability and clinical knowledge in the colleague feedback, most of it is really around the way, their manner, the way they operate as a person within a care team and with the patient. So these are sort of, in some ways, humanistic skills, not hard clinical skills that people will comment on. And that's what the multi-source feedback is picking up. It's providing a workplace-based assessment that is quite different from other clinical assessments, which are important, obviously, but the multi-source feedback fills a gap within that plethora of assessments for the trainee in a sort of formal, structured, validated way, both patient and colleague feedback. So hearing from non-doctors is really important. So you as a debriefer will know that. So if you do get that comment from the trainee that, well, it was a it's just a nurse that said that, then yeah, I would explore that further as a debriefer, and hopefully there's some learning for that particular trainee. So yeah, coaching an exemplary trainee. Is there such a thing as an exemplary trainee? Some might say yes, in the context of a trainee. Some may say that all trainees have areas to improve. Well, we could say that about all of us, couldn't we? So you as a debriefer, you'll know that we're on a journey of lifelong learning. We're all learners. And how do you coach a trainee who's done very well? Well, I think one of the first things is to acknowledge that they've done very well, and they hopefully can see that. Hopefully, I have had one example where they did extremely well, but there was one comment that just took the edge off that exam, and they wanted to focus on that one comment. Now, as a debriefer, your challenge is to acknowledge that yes, there is a comment around something that you're a little bit concerned about. There's also lots of other things, and the rest of the report is quite positive. So can we focus on that in the first instance and then come back to that? And they might say, yeah, why not? Yeah, let's have a look at those. I knew I was pretty good in those things. And that's why I would ask the trainee, so tell me a little bit more about what you do to get such exemplary results. What would I see you doing? What behaviours would I see you enacting to score high on the way you explain things to patients, for example? What do you do in a consultation by way of explaining that generates those high scores? Or where you've scored highly in the way you've respected your colleagues? How do you demonstrate respect in your workplace? What do I see you doing or not doing? So even though they've done very well, I think it's important for the trainee to know why they've done well and how they do that, and to keep doing that. So, as a debriefer, you might want to focus on continue doing those things. And there may be some areas where you stop doing, and there may be some areas where they consider doing. So I think, it's all in the context of lifelong learning. We can all improve, but we can also all focus, and this I think is the point I've made in earlier presentations. The reflective practitioner is one who looks at what they do, both good and possibly not so good, and tries to change or keep doing what they're doing well, and to know what they're doing. That's important.
Coaching the trainee with many gaps is about prioritizing what you want to say, recognizing that you can only do so much in any given session, and you need to focus on those gaps that might suggest problems in the workplace, problems with patient safety. Now, occasionally you'll find a trainee who can't believe they have any deficits. They've always been rated nearly perfect on scoring systems. Perhaps this is a North American syndrome from our school system, where little children get gold stars and pats on the back, and only the brightest and highest achievers get into medical school, and they get 5 out of 5 on all of the scoring systems. But occasionally you'll find a trainee who just is in shock that they would get feedback that they feel is subjective and unfair when they've been very nearly perfect their whole life. Again, it's a question of what have you figured out from the report? Don't forget their strengths, but also be somewhat directive in identifying areas that they can improve. This is about being in a growth mindset and getting better, and reminding them that even Olympic athletes who are the cream of the cream have coaches and trainers and advisors, or they're not going to get that gold medal. And, I think that most trainees will respond if you have an honest and fair discussion with them. So that really brings us to the end of our challenges, I guess, considerations if you are working with trainee physicians, and lots of resources are available to you. And we hope that you will avail yourself of them. There is a guideline sheet which covers many of the same dilemmas that we've talked about today.
Thanks, Jocelyn, and we wish you well in whether you're a trained coach in multi-source feedback debriefing, or a supporting medical colleague, trusted peer. Hopefully these resources that have been provided to you are helpful in that process. Thank you.